Good evening, everyone. This is Dr. Moreau and Mrs. Dr. Moreau for Kozele Call. I'm going to, as you know, Kozele Call is here with you every Saturday. And we promised last Saturday we will continue with our mental health awareness because May is Mental Health Awareness Month. And Dr. Moreau is going to talk to you about mental health disorders of adolescent children. And I'm going to tag a few people as I always do, so that way we can have many of you join us today. And we are asking you as well to share this information with your friends, because we don't want them to miss this invaluable information. So without taking much time, I'm going to let Dr. Moreau take over with mental health disorder of adolescent children.
Hello, everyone. Thank you for taking the time to participate with us in Kozele Call this evening. Again, welcome our guests. Please share this link with your friends or family, your neighbor, anyone you think may benefit from this information. Anybody you know with children, especially children, young adult children, we'll say up to 18 years old. We know mental health is an issue that affects everyone throughout, any life spectrum. So therefore, it does not discriminate from children. Children, contrary to what we may believe, still suffer from some of the mental health disorders that adults suffer from. The only difference with them is they exhibit those symptoms and they exhibit their disorders differently. So we'll talk about some of the disorders that affects children and adolescents. We know one that typically is a lot common that we do talk about, and a lot of you hear all the time, is autism spectrum disorder. Autism spectrum disorder, and the reason it's called a spectrum is because there are several different other diagnoses that falls under that umbrella. Autism spectrum disorder is a disorder of pretty much social, I would say social behaviors or abnormalities. You have intellectual disabilities that fall under that spectrum. But for the one that we usually use is the term autism. You may see that child have social disabilities. They lack social planning, they lack social skills. Some may exhibit some form of mutism where, they're shy. It's not like, the excuse would be, well, the child is shy. Not so much so that they're shy, it's the fact that they cannot express themselves socially. Again, some of these disorders that we talk about, and then one might say, well, what are the causes of these behaviors or these disorders in children? A lot of the disorders up to this day does not have an etiology. Etiology meaning they don't have a scientific reasoning. For autism spectrum, it is believed to be some sort of abnormalities from the chromosomes, either chromosomes, maternal or paternal chromosomes. You have some that are missing either chromosome 23, where, during cell formation or during the sperm formation or during the mitosis, that chromosome is missing or the link is not done properly. Some may be from the paternal side, chromosome 15 is missing or chromosome 23 is missing. At any rate, we don't want to focus too much on autism spectrum because there are other disabilities that we want to talk about. So we will focus more on autism spectrum a little later and give you all the different details of autism spectrum, but I do want to focus on the mood disorders of children. Mood disorders in children, we say anxiety, major depression. Children suffer from bipolar disorders just as adults do. The only difference, as I said earlier, is as opposed to adults showing those behaviors with sadness or loneliness or hopelessness, children exhibit depression, anxiety, or any kind of mental health disorders through irritability and anger, and that's how they would express that disorder. You have anxiety disorder, depression, major depression, same as in adults. We will focus more on the symptoms that causes some of the disruptive end behaviors, since the way that they express depression and anxiety or bipolar disorders is through behavior. So the behaviors, different types of behaviors, have different categories in mental health. One is disruptive mood dysregulation disorder. It's a long word. To make it short, you will hear specialists call it DMDD, disruptive mood dysregulation disorder. This is where the child will show frequent verbal, and I mean verbal, physical temper tantrums or outbursts. They will express those outbursts sometimes for no reason, because again, that's how they express that feeling of depression. It's persistent, it's irritable, it's anger mood. The onset for this disorder is prior to age 10. Again, we hear, your kids are growing up, you walk into the store, grocery store, and the kid, throw a tantrum for no reason. No reason. Some of them may say they want a candy. And the ones who throw a tantrum because they want a candy, there's another name for it. We will cover it later on. But disruptive mood dysregulation disorder has no reason at all. They just throw severe temper tantrums. Again, in the setting of school, at home, with their peers, with their friends, with their parents, they don't have any control over those behaviors. To differentiate with you guys between some of the behaviors that I talked about, where I said disruptive mood dysregulation, the difference between the one I said that has no reason, intermittent explosive disorder. This one is an impulse control disorder. Again, they don't have any control over their impulses. They want something, they can't have it, then they throw a tantrum. Tantrum could be severe. It could last a good 10, 20, 30 minutes. No control at all. The parents cannot control the child. Sudden anger outbursts. No identifiable reason is for the mood disorders. Again, those are symptoms that we may see in our kids as they grow up or in school. The teachers may call you about that child behavior in class because they see a pencil that they want, and then because they cannot have that pencil, or one of the classmates may touch one of their pencils, then the outburst is the tantrum that they throw is really not cohesive with the actual action. Someone touches a pencil, then they throw that tantrum. They can get physical, they can hit the other child, or they want a toy from the other child and they start hitting on the other child for no reason. Those are, again, things that we say are things that could be regulated, that could be addressed in children. The reason we want to bring them up with you at this time is so you can speak with your physician, talk to your doctors about the behaviors that you see your kids are exhibiting. 15. Are you able to pause? Can you say one thing in Creole? which will translate something in Creole.
Bon, en créole, ça me dit c'est que gen petit monde ou gen doit sortir avec wala dans magasin wala acheter et pour il était comme ça et pour il t'a remis un bagage et puis automatiquement il commence à faire des ordres. Il commence à pas agir en façon parce que ça le t'a remis il pas qu'à jeûner. Comme ça tu gen petit monde qui gen dans classe. Et puis, on l'autre élève, mayen valise yo, yo gen mayen livre yo, crayon yo. Et puis, yo été comme ça, yo réagi en façon qui pas naturelle. Ça veut dire c'est un problème, une maladie, ti moun sa gen, la kaili qui fait que li réagit comme ça. C'est ça qui fait l'important. Lorsqu'on remarqué ça arriver avec petit tout, c'est pour parler avec docteur li, pour docteur capable expliquer et façon ça yo que ti moun a réagir leur que par exemple on l'autre ti moun capable et mayen a faire li ou bien s'il t'a vle un bagay que li ouais li t'a aimé acheter par exemple en qualité candy dans magasin.
Another one I want to bring to your attention is oppositional defiant disorder. Again, the name in itself says a lot. Oppositional defiant disorder, where the child does not follow rules. They don't listen to the parents. They don't listen to teachers. They're deliberately defiant. They loses their temper, anger, easily annoyed, argumentative, does not progress. This disorder, I would say, does not progress to conduct disorder or antisocial disorder, which is the other two that I will cover with you. Oppositional defiant disorder, like I said, is, again, they're not afraid of authority. They don't afraid of, adults, their parents, their teachers. You can say one thing, then they want to rebel, and they want to answer back, and they want to talk back. And again, treatment for this type of disorder will be therapy, will just be behavior therapy, will be probably parent counseling, because again, you have parents who are out there who have, I wouldn't say lack of discipline, but again, they may not know how to discipline this child that is somewhat out of control, because they will see the behavior but don't know how to correct it. They have parenting class, they have therapy for these children to try to change those maladaptive behaviors into positive behaviors. The other two that I brushed upon is conduct disorder. Conduct disorder is a more severe form of oppositional defiant disorder. Conduct disorder occurs in kids younger than 18. You would have had to be diagnosed with conduct disorder before the age of 18. Again, it's a behavioral problem. This one is a severe behavioral problem because at this point, your child is an adolescent. They're 14, 15, 16, 17, 18. They are really, really disobeying the law. They lose their temper. They're angry. Again, they are very aggressive. They get physically abusive towards their parents in the house. Again, you have parents at home who are being abused by their children because, again, conduct disorders. The children become physically abusive towards their parents. They are abusive towards animals. They set fires. They do things that are really, really testing the law, either outside of the home or inside of the home. Conduct disorder in children and adolescents, if those behaviors are not, again, addressed, it turns into what we call antisocial behavior in adult. The difference between the two is you might have antisocial disorder. This person does not have any remorse for anything that they do. They think pretty much their behavior is so out of control at this point. They will commit any crime. They will do anything. They go to jail. These people are in and out of prison. because they think they're above the law. Not even above the law, they just disregard the law. The law does not apply to them. These things we're bringing up with you guys again, so when you see these things in the home as you are rearing your children, these things are not behaviors that are normal in children. Again, there are families who don't want to speak up. They don't want to talk about it because, who wants to say that their kids are misbehaving? Who wants to say their kids are, again, labeled bad children? So as opposed to later on letting this child end up in jail because of their behavior, we are bringing this up with you guys and Cause L'Ecole so that you can get your child the help that they need today or now, so it doesn't resolve into worse behaviors later on in adult life. We have also one of the famous ones that you guys are very familiar with is attention deficit hyperactive disorder. Again, this is ADHD. You have children who are diagnosed with either portions of it, or you have children who are diagnosed with both, because they can have attention deficit and not have hyperactivity disorder. So then again, those are things that we wanted to bring towards your attention. Next week or towards the end of the month, I will speak about some of the medications that could be used to treat some of these disorders. Next week, I wanted to cover some of the mood behaviors in adults, so you can see the comparison in children and how adults express those behaviors and how children express those behaviors, with the idea that these behaviors in children are expressed through irritability and anger, as opposed to depression and helplessness and hopelessness in adult. I'm going to challenge you guys to keep an eye out for your children in the house. Your elementary school children, your middle school, your high schoolers in the house, how they behave. How do they behave with you in the house? How do they behave at school? How many phone calls are you getting from these teachers? How many phone calls, how many referrals, how many times they've been suspended, how many times they go to CSI because of lack of behavior. They can't control the behavior. And again, they would need to be placed on medication or therapy. And sometimes they may need both. They may need medical medication and therapy to manage the symptoms. Again, I want to thank you guys for spending the time with us today. Hopefully this information is informative for you and you can take it with you, share it with a friend, share it with a colleague, share it with your neighbor. The most important part is to keep an eye out on your children. Again, there's no sense of trying to cover the maladaptive behaviors, and then later on when they grow up, they end up in worse situations when things could have been prevented right now. Again, thank you for your time. I will pass on to Dr. Moreau. Have a great rest of your weekend.
All right, everyone, just to close and conclude, as you know, my wife just mentioned regarding these behaviors. So I quickly dis en créole, côté que les petits monde ont trois behavior ça yo, behavior et opposition, les gagne et behavior conduite avec antisocial. So yon ça yo veni yon vraiment après l'autre. So les que ti monde gagne behavior opposition ou pas faire rien avec ça. Là commence à venir plus grand, il vient affecter conduite li. Et à cause de conduite qui pas bon, là commence dans 15, 16, 17, 18 ans. Là que ti moun sa vient en grand monde, il vient à montrer behavior antisocial. So là il vient behavior antisocial ça, au ça vient arriver à en prison parce que la France c'est des bagages qui pas aller avec société et bagages ça a commencé depuis là que l'été gain opposition là que Timon là était dans élémentaire school et puis ou pas chercher aide pour aider. So combien Timon parents et l'école n'a pris Léo tout le temps. Ils prennent dans détention, ils prennent dans punition l'école là parce que à cause de behavior de gens que la pas agi l'école là. Et puis ou même ou va jamais chercher aide pour lui. So, le par exemple, ou recevoir l'école là, non mais un professeur, non mais et un principal, assistant principal, cap dit oh mais qui j'en petit toi a pas agi l'école là. Et ti moun sa yo gonna même voir la caille pour suspension parce que la fait des autres l'école là, c'est pour mener aller faire un assessment, c'est pour aller mener la loi en thérapeute ou bien la loi docteur li, puis on capable connaître si a mettre sous médication ou bien si a fait médicament ou bien si a barré et fait thérapie avec elle. So, il n'est pas obligé de prendre médicament parce qu'il y a plein de monde qui prend un médicament, mais il n'est pas obligé d'aller dans la thérapie. Mais situation est tellement sévère que vous obligé de les médicaments quand même pour capable contrôler et symptômes et gens que la pas agi pour parce que le médicament a fait plus et la plus bénéfice avec lui et puis ça capable aider à améliorer gens que les agi dans la société. So, no pas être trop. Like my wife said, next week we're going to talk more about medication. We're going to talk about adult behaviors, so that way we can see the connection between a child and an adult, the difference between the two as well, on Cause l'école. So please continue to watch us, continue to share this information because we don't want anyone to miss out. And we're trying to change this stigma in the community about mental health. And the more we talk about it, the more we bring awareness to people, then they will be able to seek help when they see certain symptoms in the children and maybe even themselves, because mental health does not only impact children, it also impacts adults. So we want you to be aware of the symptoms and to seek help whenever you need that help. Thank you again for watching Cause l'école. Enjoy the rest of the weekend. Be blessed.
Thank you.